I know all the data is not in, but I'm looking for a summary, Dr. Henry, on what your recommendation is to people about whether or not they want that booster dose right now.
And thank you for that. It is an important consideration, and I think that the message that I have is that most of us have good, strong protection, and we don't need a booster dose right now. But come next spring, it is something that we should consider for longer-term protection. For the groups of people that we're focusing on right now, so those are the people who were immunized first because of their risk, and the biggest risk being age. And we know the older we are, that we don't mount as strong an immune response to vaccination. So I absolutely recommend it for people who are over age 70 in the community, for people in long-term care and assisted living, for our Indigenous people who we know are differentially affected and for a variety of reasons are being more exposed to the vaccine, to the virus right now because of outbreaks we're seeing in communities, and for those us healthcare workers who were immunized early on, who are where it can be not only a risk to us and we might not have severe illness, but it can be so disrupted to our healthcare system where it's so strained at the moment. So those people who are eligible in the next few months will be making this as available as we can to you, and absolutely recommend that you take this booster. We'll have more information as we follow what's happening, as we look at our vaccine effectiveness over the next few months, and we'll be updating the recommendations to the young, healthy people as we go into the new year.
Justine, do you have a follow-up?
I do, and thanks for that. And this is to Dr. Ballem. I just wonder if you can give us some numbers around how many people are expected to be getting their third dose by the end of this year, and if you've got any update on where we're at. I know you say we have a robust supply of vaccine, but are we actually giving more back because some of it's expiring, or just what does the supply look like right now?
So thanks, Justine. And to the answer to your first question, we estimate we'll be vaccinating, we're projecting the capacity to vaccinate about 500,000 people between now and the end of December. So in terms of our vaccine supply, we certainly have vaccine on hand. We keep vaccine at Innomar facility in Ottawa, and we're in close touch with our federal colleagues. So we know we can draw down, at least what we're going to need, and there will be more if we have, a response that is more robust than even we were projecting. There will be sufficient vaccine on hand.
For the next question, we go to Richard Zussman, Global News.